In order at 1:25. Councilor Sell's going to give the invocation.
Rise, please. Dear Heavenly Father, thank you, Lord, for this day. The Lord be with us as we go through our meetings today. Bless the Cherokee Nation, bless the Chief, Vice Chief, and all council members here today. And Lord, be with us as we go through the procedures today and give us knowledge, wisdom. Let's pray all this in your name, Jesus. Amen.
That's okay. I want to welcome everybody and hope we have a good meeting. And remember, it's Christmas and everybody work joyfully together in the Christmas spirit. First, we're going to have a roll call. Please, Ms. Shelley.
Janelle Fullback.
Present.
Dick Lay.
Here.
Here.
Zach Baker.
Here.
Joe Bird.
I'm here.
Julianne Coates. Here. Jody Fishingham. Meredith Fraley.
Here.
Tom Garvin. Kylie Glory Jordan. Frankie Hargis.
Present.
Chuck Huskin Jr.
Here.
Lee Skinner.
Tommy.
Curtis Snell.
Here.
David Jordan. David Walker-Stick. Karen Calhoun Watch.
Honey.
We go with one.
Thank you. If everyone's had a chance to look at the minutes, I call for their approval.
I make a motion to be approved.
Second.
All in favor of approval of the minutes, let it be known by saying aye. All opposed? The minutes are approved. First, we have reports from Claire Moore, Mr. George Ballard.
Good afternoon.
Good afternoon.
First, I'd like to introduce our new ambulatory care director there at the hospital, Lieutenant Commander Kelly Batiste. He comes to us through the White Cloud Clinic up in Kansas. He's been there a little over a month now, and so any ambulatory care issues, Kelly's your man.
Welcome.
Well, my report should be in your packet. Outpatient visits are up. Collections are already up for the first month. So things are going well. Are there any questions?
Yes, Councilman Law.
I think last month I'd asked, and it may be a joint question that has to be responded to, but how's it working for our patients in terms of the 5% set aside on contract health services? Maybe if you'll answer from your perspective, and then Connie can answer from hers.
Okay. Well, from our end, I make sure that Brett has the information he needs to go in and pick out the Cherokee Nation citizens to take before the committee, the Cherokee committee. That's our end of it.
And how long is that taking typically? Is it within a week?
Oh, he can go in as soon as we put him in the computer. He can extract that information.
And they don't have to contact us. That's automatically done?
Yeah.
Okay. Thank you.
Yeah.
Anyone else have questions?
Thank you. Merry Christmas.
Cherokee Nation Health Services, we'll hear from Ms. Connie Davis. Welcome, Connie.
Thank you. Good afternoon. You have the health report before you. If you have any questions, I'll be glad to entertain those. And to also let you know that Dr. Chuck Grimm and I attended a meeting. Finally, I feel like we're making some leeway on the Affordable Care Act and its impact on the state of Oklahoma, and particularly the Cherokee Nation. And I hope to be able to do a presentation to you guys in January. And we're making some plans to work very diligently and aggressively with the other tribes in the state to meet with our local representatives to do like an impact statement on our own communities and make it very personable so that they go back in session in February. They can be posed to start fighting for Medicaid expansion specifically for us.
Ms. Councilman Watts?
Thank you. How do we anticipate the impact from the veterans healthcare. I'm trying.
I know
sorry.
you've done that for the last few weeks.
The MOU between IHS and the Veterans Healthcare.
I'm going to defer that to Dr. Grimm if you don't mind, because he's been in those meetings and is a better apprised of that than
I'd be
I.
more than happy to address that question. Good afternoon, everyone. It's been some time ago, but the Veterans Administration and the Indian Health Service at the national level began working on a MOU or an MOA, Memorandum of Understanding, Memorandum of Agreement. I don't remember which one they called it. But it came about as a part of the Affordable Care Act and the Indian Health Care Improvement Act. And it was part of a bigger purpose to have the federal government work better and closer for our veterans, and in particular our Indian veterans. One of the things that it's going to do for us, tribal programs and Indian health programs, is it will allow us to build a Veterans Administration for direct care services that are provided within our facilities. The VA and IHS nationally just released a document that is the final document that was signed for the federal sites. Each tribal program will have to negotiate with their local VAs. So for us, the first one will be to go after the one in Muskogee, the one closest to us, and negotiate agreement with them directly. But now that this national one, a lot of tribes were waiting for this national one to be signed so that they would know what was going to be discussed in the way of rates and things for reimbursement. The Alaska tribes up in the Anchorage area had negotiated one earlier than this particular national VA agreement, and there are one or two in the state that had been talking with their VAs. We have our name in as soon as they have time to begin discussing with us, but as you might imagine, tribal programs are starting to line up since we need to negotiate things directly with them. So it should mean some increased revenue and better coordination for our patients that are veterans.
Yes, Councilman Watts.
Thank you, Madam Chair. So when we do that, do we anticipate that we will assure proper PTSD, behavioral health services? Because we're so short of behavioral health. I want to make sure that if we're taking on that commitment, I see that as a unique need. Will we be able to accommodate that?
Well, we are doing some PTSD treatment now. The VA does far more than we do, as you might imagine, and their staff are, I would say, probably more trained in it, just because they deal with it on a daily basis. In the past, the VA has been willing to provide training to our staff if we so wish, and it might be one of those things where if we don't feel that we can develop the capacity to do the entire veteran population that way, we certainly want a number of our staff to be trained to do that, but it might be one of those things we work out with them where we still want them to do a heavy part of our PTSD treatment too. So that'll be one of the things we talk about, because it is a big problem now with returning vets, has been for some time.
Thank you, because I do get feedback. I mean, there are some that want to go to veteran services because they feel more comfortable there in terms of their needs as veterans. But there's a lot that really want to retain Indian health care, but they still have that unique needs. Thank you, that helps.
I think that brings to point something else I learned in the last few weeks is that substance abuse, depression, and behavioral health needs are the third biggest disease that's treated in the state of Oklahoma now. And so it rates right up there with the heart disease, cancer, and diabetes, and it's just astounding at what we have to deal with, and there's not as much funding for that as the demand is. So we're looking at ways to help even right here in our employees within Cherokee Nation. It's a great need.
Thank you.
Councilor Keener, you have a question?
Thank you, Madam Chair. This may be for Dr. Grimm as well, but I was on that. I think it's I want to say it's an MOU that they're working on. I can't remember exactly either, but does that include not only the hospitals, but like the facility in Claremore too? It would. Okay. And so will you be getting in contact with them at the same time, or you did say you were start with Muskogee, but
Well, the agreement that was signed nationally that I just mentioned, and you can go out, we can get you a website address to go out and look at it, or send you just a PDF copy of the document if you'd like. That one was for the federal facilities. So Claremore and any other federal facility, now that that document is signed, it's in effect for them. We, on the other hand, as tribal programs, have to go out and make contact with the individual sites that we might want to work with, and then we would use their agreement that they've negotiated, because everybody's happy with it, as a template. And we might not change much of it at all, but now we have to go out and do that on our own. So Claremore really is a little bit ahead of us in that they can use that document and go forward with it. I don't know if George or would want to say anything about it, but it's already in place for them now that that has been signed.
I just read the first part of it, I guess, on the agreement, but it sounds like it's going to be a really good deal.
It's going to be
for
great.
veterans.
It's going to be great, I think.
Thank you. Thank you, Madam Chair.
I've got a question, and I think it's more directed at Dr. Grimm about to give us a little update here about what's going on down at the Redbird Clinic. Or do I need to direct that to Connie?
I'll stand here and let Connie get started if she wants, or if you want me to go.
Well, we're still trying to determine a final plan on what we need down there, and as soon as those plans are completed, they meet weekly, and I hope to have an answer within the next few weeks on what exactly we're going to do.
Regressing back here a little bit, but I've got another question for the Veterans Center. The way they are treated. Will state lines make a difference? Because down in Sequoia County, most of our veterans go to the VA Center in Fort Smith, Arkansas, or Fayetteville. Well, will that matter? I mean, like, they don't use the clinic at Muskogee.
What we would need to do is, if we have a number of veterans that are being seen in different places, Oklahoma City, versus Muskogee, there, we will need to approach each of those and try to get an agreement in place.
So you'll be reaching out to them.
We'll probably be looking at which one highest volume and then moving down the line from there. Or if there's some way we can capture them all at once, by meeting with the VA Medical Center directors, perhaps each in a single meeting, we might try it like that too. But no, we'll have to, the way I understand it right now, we're going to have to go to each one that we want to have an agreement with.
Well, I've got another question, but I don't know if it's for you or for Connie.
I'll stand
All
here.
right.
Get exercise standing up.
Get the Affordable Care Act going, and we have a contract with Sparks Hospital in Fort Smith. Cherokee Nation does. The other large hospital down there never would contract with us, and we've seen quite a few people down there, and because it's so much closer than Tulsa, that's where they prefer to go. Will we have to renegotiate that contract when the Affordable Care Act goes? I mean, it took years to get it the first time.
Well, the state's not participating with anything right now, so I don't even know.
Too far-fetched.
I don't think it has an impact on anything like that. We can still continue to refer patients if that's the question or concern.
Yes, Councilor Burke.
How long is that agreement with Sparks?
As far as I know, it didn't have an ending date on it.
I would have to check. I'd have to look at the contract.
Do we have similar agreements with like Tulsa?
We have agreements, yes, with several hospitals.
Well, just for clarification, there are several different types of agreements because actually we have an agreement with Sequoia Memorial Hospital, a small hospital there in Sallisaw, but it is totally different than the agreement we have with Sparks. I mean, when we contract someone out to a specialist over to Sparks or for a procedure, the only agreement we have with Sequoia Memorial is just that they will accept the Medicare rate, and people are only to go there as an emergency unless they're referred to for the sleep studies or a scan of some kind. Isn't that right, Connie?
Some services that we don't provide directly in that community, yes.
But I think that might be particularly interesting, maybe to Councilor Lay or someone, because when you live a long way from Telequad, a lot of people might prefer a different hospital than being referred to Oklahoma City or Tulsa.
Thank you.
Thank you. Anyone else have questions? Yes, Councilman.
Thank you. Yeah, just one real quick question. On that Affordable Care Act, it's reauthorized permanently. Is that correct? So
That's
there's
my
no
understanding.
time constraint. Okay, just want to make
That's
sure.
my understanding.
Me too. Okay. Thank you. Thank you, Madam Chair.
Any more questions for Connie? All right, thank you.
Thank you.
Next is old business up for discussion, comparison of healthcare provider salaries. The sponsor is Jay Fishing.
Can somebody tell me where you all stand on this? It's been on here since this summer.
We are in the final phases of gathering data and getting it ready to present to the treasurer's office and to administration for final approval.
Okay, I was on an email that it had Lacey Horn, Charles Head, and the third one was Bill Foster. Is any of them three here? What has took so long? Lacey, come ahead and come forward. What's took so long?
Well, we've asked Health to put together an exact plan on what they want to do. So far, we've been dealing in a lot of hypotheticals. We've had a couple numbers thrown out, and we've not been able to verify those. So we've just sort of backed up the truck. We're trying to do our due diligence on this, and we're trying to see if we can afford it both in the near term and the long term. It's a major undertaking.
It's a major undertaking, but we're really getting ready to do some major building. And when we build, we're going to need doctors and dentists and healthcare providers. And the more healthcare providers we have, the more hours we can build, and in turn, that building can turn around and pay for the doctors. This needs to be done. We have talked about it this summer. Can you all give us a date? Charles Head's in here.
As soon as we get a proposal in writing from the health division showing us exactly what they're proposing to do, we'll be able to analyze it and then be able to give you a date.
What happened to the previous one I looked at?
We haven't seen a specific, exact proposal on what they're proposing to do, and that's what we're waiting for.
When we were sitting in one of our work group committees when we first started it back this summer, there was a couple of numbers thrown around. Did you all run numbers on what was thrown around?
Well, we're waiting on the health division to provide us with a worksheet showing us exactly what they're proposing. The treasurer needs to analyze that to decide exactly how much of a dollar impact that will have on their budgetary constraints as to whether we need a budget modification or not to bring forth, to get permission to modify the budget if we need to. Until we get all of the numbers, we can't. We haven't been able to analyze anything because we haven't seen anything specific. They brought up generalized terms, generalized a few percentages here and there, but we want to see exactly what they're proposing, exactly what budgetary impact it would have on the health budgets. The treasurer has a responsibility to analyze whether or not a budget mod would need to be prepared to be brought forth and approved by you all or not. And we're just waiting on that specific information so that we can all sit down and analyze it and decide how we need to proceed.
Okay, Lacey, you nodded your head when I asked you about a couple of numbers you've thrown around. You said you did run some numbers on percentages. Can you tell me about them?
No, not off the top of my head, no, I can't.
Can you send what you all did run over to me since you've already run it?
Ask the question again, please?
I asked you, back in our committee meetings, our work group meetings this summer, late summer, they had thrown around 2 or 3 numbers and percentages, and I asked if you all had run numbers on them, and you nodded your heads yes.
Those were not numbers from finance, and those were not numbers we were able to verify. So no, I cannot provide you with accurate numbers based on what health is giving you.
Okay, have you all looked at the billing, about how many more slots they could be billed for? I mean, you're running projections and trying to figure this out. I know for a fact if we have more providers, we can bill more hours, and in return, we can pay for the providers.
We're looking at every angle.
Okay, how many are we short?
I don't have that number.
Do you all think you all could get it within a month?
We're 22 positions short of.
How long do you all think you need? This is irritating. We've been on this subject for a while. Todd, are you going to answer in your capacity as a health director or as an attorney general?
As just a servant of the Cherokee people. You are absolutely right. I mean, we are getting ready to embark on a major improvement in the an expansion in our healthcare. So therefore, when we hire these new doctors, we need to make sure we got the process in place to make sure that we can compete and afford these doctors so we can get the services to the people.
I didn't mean to be smart, but I've heard this same song and dance since this summer.
Well,
You all not told me anything new.
And the deal is, we want to make sure that we're comparing, apples to apples, not apples and oranges. So, the health has been working on a set of numbers. Finance has been working on a set of numbers. We're going to make sure that those all mesh, and that when we present to the council, it is a complete picture. So, can it be done in a month? We hope so. I can't make any promises, but we are going to make sure that what information is given to the council is a complete whole picture, and that's what we're working on. And we apologize that it takes so long, but we're going to make sure that whatever is disseminated is correct and accurate, and like I said, the total picture. They've been working real hard. The finance has been working real hard, and we will get you that complete picture.
And it's been more than a month. Like I said, it's been since last summer.
I understand.
And I think I have had plenty of time, and you all have had plenty of time to do this. The fact that you all didn't think it as important as the council did is not my problem. I want some numbers, folks.
And we will get you the best numbers possible.
And I want to see what you all got by next month. If it ain't complete, I want to see it. I'm getting aggravated. That's all.
Okay, thank you. Councilor David Thornton?
Yes, I just would like to know something at the next meeting, about these vacant positions.
An updated vacancy list? Okay.
They would fill some of these jobs that we're looking for right now to be in the new clinic or hospital or everywhere. And I think we have some vacant positions out there we need to look at first and try to get them filled before we go in and try to put other people to work. But I've got a little, I know that when you come in, you started without a whole lot of knowledge about the programs. And a whole lot of knowledge about how to work for this group here. And I think you've got some pretty good experience just the last 6 or 8 months.
Thank you.
And I
You guys have taught me well.
the problems and the adversity that you've been through.
Thank you. I appreciate that, Counselor. I do.
And I think our health group needs to go back and start meeting probably next month in January. Get the holidays over. And I think it would be to a big advantage.
I'd be happy to do that.
Councilor Kellen Watts?
Thank you. I haven't had the opportunity to be part of those discussions. I think it's been tabled. Do I need to continue carrying this around, or is this no longer part of the discussion on the comprehensive study of health professional compensation?
We are using some of that data with what we're working on now. So,
because you're going to repackage it, so I can. Okay. So on this, some of the things that I know, I've been waiting for something to review, and we haven't gotten that, which is understandable. It's a major undertaking. So I think what I heard today and some of the questions I had were, what are existing vacancies? Understanding why we have vacancies? Because I know there's a shortage overall of healthcare providers, nurses, every level of doctor. No matter how much we pay, they just don't exist. To some degree, there is that at play. Lifestyle, geographical choice, other things besides money play into it.
absolutely.
And I was hoping that those things would come forward with it, and not just the financial aspects of direct compensation, but the bigger picture.
Like a recruitment plan that
Yeah.
that's just not money or financially driven
Because as a
necessarily.
government, I don't think we could ever satisfy financially what some people go into the health professions wanting to make. I don't think that's necessarily even who we want to attract, just my humble
Absolutely,
opinion.
absolutely.
And we can't afford it, I don't think, what some people would want. So there's a new dynamic on this whole discussion. We did start so long ago as before the $80 million effort And after last month's meetings, it was clear to me that we didn't have our understanding of what capital and operating costs we would recover from the federal government in terms of the Cherokee people's money. And it's finite. We don't have a printing press in the background. And we have no idea how long the golden goose will continue to lay eggs. So not only is it just the straight, what I heard Lacey or Treasurer Horn speak to, the immediate impact to the budget, and then you start adding cost of benefits going up. Lots of cost, not just a straight salary. So we also then, we're going to increase the capacity, I assume, because we still don't have a plan, so I don't really know, I'm assuming. We're going to increase the capacity, meaning we could put more providers in for direct services. But if we're not going to recoup capital dollars and operating dollars in that health plan, and we're going to start paying exorbitant salaries to providers that may not even be on the payroll at this time, will there be money for services and for equipment? I mean, these are the questions I'm asking myself.
And that's the feasibility study that we're conducting and have been conducting the last 6 weeks. And to find out exactly what can we afford with the capital improvement expansions and with the, to recruit the providers. We don't want to recruit somebody, like you said, if we pay them an exorbitant amount of money just to come for the money. We want them to come to serve the people. And I believe we're going to have a good plan to present to the chief and to the council in a way that we can do these things.
Because later in executive and finance, I saw on the budget that we're taking a significant amount of money out of new equipment to possibly pay for a Jack Brown treatment facility, and that facility needs to be replaced. I get that. But we also have to have new equipment, even in our existing facilities. So I'm going to have questions around that, and that's part of this bigger plan that I'm not seeing. And I'm a little bit concerned, well, a lot concerned, a little bit frustrated that each month we seem to be chipping away at what we really do well right now and what we know we fund in order to start doing this other stuff, and we're not seeing the full picture because we're only getting these single decisions, little decisions made, and eventually it's going to collapse on itself. So I really, you may stick around for executive finance because I want to understand if we make this decision, we're making a choice and it's going to impact this over here. I want to understand what it is before I vote on it.
I understand.
Thank you. Thank you, Madam Chairwoman.
Councilmember.
Thank you, ma'am. Connie or Lacey, is the $50 million from the feds, is that in-house yet?
No,
Have you heard from it? On its way?
I don't think so.
At these meetings that apparently Charles had and you and Ms. Horn and maybe the general are having, who else is in the room? Are there any counselors in the room?
No.
No legislative branch in the room?
No.
Not Madam Chairman of the Health Committee? Nobody. Why not? Is my question.
Well, it just really depends on the meet. I don't know, there's a whole blanket of meetings that obviously we keep the council engaged and informed on every aspect of government. And when we get, when a meeting occurs, it just really depends on what the topic is and who's the person that you're meeting with. But rest assured, we engage and keep the council informed every step of the way.
This council is not informed. We don't know the numbers that y'all have been talking about. There apparently some meeting about the new health clinics that's going on with you all, that we're not in the room to at least listen to what you're discussing. I think that some of these counselors need to be in that room.
Well,
That's what I'm going to throw that forward.
Well, and again, we will engage the council in every way possible. But
you're engaging me now, but you're not letting me in the room when you guys are making decisions.
That's
my point.
But that's part of government. Is that the executive branch administers and the legislative branch legislates.
Part of government is this body holds the purse strings to your office.
That's why we come here to these meetings
when these decisions are being made.
And this is where these decisions are made. I mean, I'm not trying to, be confrontational at all with you, but, there is a division of government. We will make sure that we get all the information. And like I said, speak
I
it
think
to
you all have heard today from several counselors the frustration that we're feeling from not being in the room. You're coming and telling us we'll be next month. How many months have we heard that? 6 months?
It's a major undertaking.
And
as better say, we want to make sure we can compare apples to apples and oranges to oranges. And that's when what we present to you, we want to be the total picture. That there is no confusion on any ground. And that process does take time.
Fair enough. You don't think the legislative branch, who controls the purse strings, should be in those meetings to aid and assist you?
No. That's why we come here to present that information to you.
That's why we need to be in the room when you're talking about these systems.
And again,
I'm going to ask right now that you select the chair lady of this committee and 2 more counselors to be in the room when you guys discuss this comparison study and the clinic expansions. I'm going to ask that right now.
No.
Are you going to refuse that?
I don't make that decision. But let me, and that is a bigger
Who makes
picture.
that decision?
I mean, I really don't know who would make that decision. But the deal is this: is that, and we want to be, again, it's the presentation, it's the information that we get, make sure that we're all on the same page. Okay.
We can't get on the same page, General, unless we're there during the decision.
What?
We will never be on the same page.
When I say we get on the same page, I mean the members of the executive branch. And then that information, we will work hand in glove with you.
I see 3 or 4 of you, and none of you apparently are on the same page with each other.
Well, that's why we need to get on it.
That's why you need us in the room.
That's
what I'm saying.
Thank you.
Thank you. I guess, Madam Chairman, they sit down, so I'm through. It's amazing to me I can out-argue a lawyer and an accountant and a health director. Thank you.
So hopefully, in the next month or so, we're going to have a report back at the feasibility study. We have one more counselor wanting to speak, and that's Counselor Jordan.
Madam Chair, given the time, I'll just hold my questions for next month. And a lot of my questions deal with what Mr. Thornton brought up, so that I have those answers by next month. Thank you.
I'd just like to make a request for you to set a time for another health group work group meeting to discuss vacancies, the salaries, and the clinic expansion.
Okay. I think we all need time to look at the calendar and we'll put together those of us that are members of the health committee and we'll set another date. And that's just a comment in general. I don't think that anybody is going in the administration or the health director or the health group are going to be coming up with exorbitant salaries for doctors that we cannot afford. We're just wanting to prop up and keep the positions that we already have to stop some of this turnover. So there is a real need there to raise the salaries of our mid-level providers as well as the physicians. And I think that we'll come up with a salary that is fair and better, but I don't think anybody's going to be jumping to a decision to compare them to some heart surgeon at Johns Hopkins. So let's just keep that in mind. And I will get with members of the work group and set up another meeting, and we'll meet with the members of the health administration. Do we have any other announcements? The next meeting is tentatively scheduled for Monday, January 14th at 1 p.m. And we want to thank everybody for the help and everyone that attended today. And I'll call for a motion to adjourn. All in favor of adjournment, say aye. Aye.
Yes.